My name is Dr. Glennis Andall-Brereton, and I'm from the Caribbean Public Health Agency. I am also Principal Investigator for the IARC Caribbean Cancer Registry Hub.
Now, speaking from a Caribbean perspective, what kind of an impact would this hub have on the region?
Well, the main purpose of the hub is to improve or strengthen cancer surveillance for the region. At this point, we have some countries which have good quality cancer data, but that is not so for most of our countries. If we are to plan adequately for prevention and control of cancer, we need to have high quality, reliable cancer data, and that's the purpose of the hub. We are working with countries which already have cancer registries to improve their data quality, and we are working with countries wanting to establish cancer registries to actually set the process up in the right way so that in the end the quality of the data that they collect will be reliable.
Now, I know it's still in the early stages. The hub for the region hasn't even been launched yet. But once it is launched, how does the data collection go about? Are there officers in each country? How is it structured?
Well, principally, we are working to strengthen cancer registration, which is what ensures that we have good quality cancer data. So already there are population-based cancer registries in some countries. With those countries, we have been and will continue to work with them to improve what they now do. And as I indicated before, we developed procedures which are standard operating procedures for cancer registration. So if there are new countries which have the infrastructure for cancer registration, we will work with them to ensure that the procedures are established for standardizing what is done in their cancer registry.
Can you speak to St. Kitts Nevis specifically? Is there a registry set up here?
Well, unfortunately, there isn't at this point a registry, but for the OECS, there's an interest in setting up an OECS-wide cancer registry. So we have been in this discussion with the OECS Secretariat to decide how this is going to be done within the OECS region.
Can you give any sort of a time frame as to how long all of this would take?
Well, it's not a magic bullet. Everything takes time, and if we want to do it right, we have to take time to do it. So the process will continue over time, and we will be working, as I said, with the OECS to define how this registry will work, and then we have to do training within the countries to facilitate the OECS virtual cancer registry.
Thank you very much.